Another very interesting tumor, that is the adenomatoid odontogenic tumor. It's also called as the adenoameloblastoma or ameloblastic adenomatoid tumor. Um, the adenomatoid odontogenic tumor is a relatively uncommon, well circumscribed odontogenic neoplasm characterized by the formation of multiple duct like structures by the neoplastic epithelial cells. The name adenomatoid has been given to the neoplasm because histologically numerous duct like structures are often interspersed throughout the lesion, which gives a glandular or adenomatoid appearance to it. The tumor probably arises from the reduced enamel epithelium during the pre-secretory phase of enamel organ development. And the pre-secretory stage is referred to the enamel organ before the enamel matrix is created. In that stage, pre-ameloblasts differentiate and begin to secrete components of basal lamina that later on will be resorbed before the enamel matrix appears. The tumor usually occurs in younger ages. Rarely does it occur in the older age. It is seen in about the second and third decade of life. The lesion is typically occurs in the maxillary anterior region, that is the upper lateral incisor canine area. Sometimes it can occur in the premolar region. Rarely does it involve the mandible in the angle ramus area. So in about 70% cases, the neoplasm occurs in association with a unerupted tooth, and that will be most importantly the unerupted maxillary cuspid. The tumor also is pretty common on the extraoral regions, and they are 10 times more prevalent in the maxillary gingiva than the mandibular gingiva, and the female to male ratio for the gingival lesions is about 14:1, and the tumor usually presents as a slow enlarging small bony hard swelling in the maxillary anterior region. The lesions often cause elevation of the upper lip on the involved site, which often results in a change in the facial profile. And displacement of the regional teeth can be seen. They can be associated with mild pain, expansion of the cortical bones, and which are usually present. Now, if the lesions are very large, it may cause expansion of the bone, which is often cause some amount of fluctuations which can be felt. Talking about the radiographic features, the central variety of adenomatoid odontogenic tumor presents as a well demarcated, almost always unilocular radiolucency that generally exhibits a smooth corticated border. One important thing you should remember is most lesions are pericoronal or juxtacoronal, but the radiolucency may extend apically beyond the cemento-enamel junction on at least one side of the root. That is, they basically involve the coronal aspect of the tooth, but however, they can extend to the periapical area also. Now, multiple small radiopaque foci of varying radiodensity may be present inside the lesion, and this radiopaque foci are called as the snowflake-like calcifications. The borders of the lesions are not well corticated, and it is often consistently engulfs the impacted tooth, including its root. Now, this feature differentiates adenomatoid odontogenic tumor from the dentigerous cyst, since the later lesion encloses only the crown portion of the impacted tooth. So, these are certain things that you have to remember. Talking about the histological features of adenomatoid odontogenic tumor, like I said, the reason why it's called as adenomatoid odontogenic tumor because it consists of duct-like pattern of arrangement. So it consists of spindle-shaped neoplastic odontogenic epithelial cells proliferating in multiple duct-like patterns within a thin, well-vascularized stroma. Now, the presence of these duct-like or tubular structures is very characteristic, and this is what gives the tumor a glandular or the adenomatoid appearance. However, no actual glandular element is found in the tumor. Each duct-like structure exhibits a central space which is bordered by periphery by a single layer of tall columnar cells which resemble the amyloblast or the preamyloblast. And the lumen of the duct-like structures is generally filled with homogeneous eosinophilic coagulum, mostly amyloids, although some lumens can also be empty. And the treatment is surgical enucleation, and the associated tooth has to be removed, and the recurrence rate is pretty rare. Now, for complete oral pathology lectures, you can visit and DM me on my Instagram page, that is Noor Saira Wajid. These are in depth lectures of oral pathology on oral medicine, along with thousands of fresh MCQs. Lectures and MCQs are made by aggregating information from various important sources, which will help you excel both in your university examinations and entrance examinations like those of NEET MDS and AIMS MDS. For more information, you can visit my Instagram page or DM me to have a chat. Have a good day. For more such videos, please like, share, follow, and subscribe my YouTube channel. You can also follow me on Instagram. Have a good day. Thank you.